from the station that's on your side. This is Channel 7 News Daybreak.
Hey, welcome back into Channel 7 Daybreak. Today is Wellness Wednesday, and Dr. David Gerson joins us now from Baptist Health Sherwood Family Medical Clinic. And Dr. Gerson, thanks for taking a little time out of your day today. We're talking about something that we hear a lot about in advertising, see a lot more of it out there in the open. Low testosterone, how it's affecting maybe more men than originally believed, or at least undiagnosed. And now we're talking more about it, bringing the conversation to light. And so if you could today just share with us some of the things that we're learning more about when it comes to low testosterone, what exactly testosterone does for the body and why it's so important not to have low testosterone.
Well, it is interesting. Men and women both need testosterone. Women obviously at about 1/10 of what men do. But testosterone is a critical hormone for us. It gives us our drive. It gives us our energy. It gives us our romantic enthusiasm, our muscle strength. But it also can play a big factor with depression and anxiety. And so that's where we were saying before that, low testosterone is probably way underdiagnosed, but it's also overtreated. And that's kind of what we're here to talk about today, because it's really important that if you're having some of these symptoms we talked about, just not feeling like yourself, not having that zest for life, being withdrawn, losing muscle mass, and of course there's erectile dysfunction and low libido, we want you to see your primary care doctor. There are lots of avenues available for evaluating low T, but we also want to make sure that it is just low T that's affecting you. There are several other underlying issues that can cause that low T, and it's not just as easy as, getting a shot.
Yeah, right. Which is something that is an option, for people who need that. But I want to ask about is this just one of those natural courses of age where it just progresses gradually over time? Or is it?
Perfect question. I'm glad you asked it. Yes. I mean, we all know that as we get older, we don't produce as much testosterone, just as women don't produce as much estrogen and progesterone. That goes along also with growth hormone, which is really important. But starting around the age of 25, believe it or not, at that early age, we start producing less and less testosterone. And, you get to the age of 40 or like me in our 50s, it can get quite low. And if it's, medically low, we have some answers for that. We have some treatments that can make a world of a difference.
Are they regular treatments? And is this something that someone would have to do forever, or is this periodic? What kind of treatment options are available?
So, injections are the most common. Topicals are very common and also the most convenient, probably. There are some depot preparations where they'll put pellets under your skin. We here at our clinic do the shots and do the topicals. Once you do start, unless there's a secondary underlying cause that we can reverse, once you do start, you're probably going to be on it for the rest of your life or until you don't want the benefits from it. If there was something that was going on earlier, that there was some illness or some medications you were exposed to that lowered your T levels, and that's why I was saying it's so important to see your family doctor or your internist, is to try to figure out if it is something that's reversible that you can be off of. But you're right, most patients, probably I would estimate 75% of them, it's going to be something you're going to be on probably for the rest of your life.
Well, if that's something you'd like to talk with your doctor about, Baptist Health is always available. Call the number on your screen or go to baptist-health.com for more resources. Doc, thanks again for joining us. Have a great rest of the week, and we'll see you next time.
My pleasure. Take care.